Hi, welcome everyone. Thank you for joining us. I'm Lauren Galvão. I'm a physician with expertise in global health and public health, and I'm a senior scientist at the Center for Global Health Equity in the College of Nursing. And today it's my pleasure to, to introduce several researchers. We are going to talk about their global health research. They're faculty from the College of Nursing at UWM. So let's start first with a definition of global health. So what's global health? Global health is a very broad field. It's an area of research and practice that focuses on creating health communities at home and around the globe. And it's an interdisciplinary field and allows us to learn and share to achieve health equity by learning from communities to address physical and mental health, pollution, disease, and more. So now let's talk about the importance of global health and global health research. So we are living through a pandemic right now. So the COVID-19 pandemic exemplifies our need to collectively address global disease, pandemics, climate change, racism, and other global challenges that the researchers are going to share about today. Also, societies made fragile by violent conflict and structural inequity are vulnerable to humanitarian crisis and disease, so it's very important to address those. And finally, there are some complex challenges of today that require community-centered and global health solutions that include a diversity of perspectives and approaches. So when we talk about research in global health, there are several methodologies. Today, the research will highlight some of them, but there are many others. So now let's hear from Dr. Luft about her research in the Dominican Republic. Thank you so much.
Hi, thank you, Dr. Galvo. My name is Dr. Heidi Luft, and I'm going to be sharing a little bit about a project that I'm working on to understand health correlates of intimate partner violence by severity of violence among women survivors in the Dominican Republic. Next slide, please. So why do we care about the Dominican Republic specifically? Well, for the past 15 years, since we essentially started recording data on intimate partner homicide and femicide, the Dominican Republic has been among the top 3 countries with the highest rates of intimate partner femicide in Latin America. And in a recent study, the Dominican Republic was the only country among all of the Americas, United States included, to report a statistically significant increase in physical intimate partner violence. Additionally, since those statistics are slightly old, but the newest that we have in terms of nationwide survey data, there is specific local data that shows that reports of gender-based violence increased. Reports to authorities increased by 47% just between 2017 and 2018 in the Dominican Republic. Next slide, please. So we used this nation-wide representative survey called the Dominican Republic Demographic and Health Survey, and we conducted a secondary data analysis looking at behavioral health outcomes like sexual health concerns, substance use concerns, and then also metabolic health concerns. And what we found is that women who reported not having ever experienced any form of physical intimate partner violence throughout their life were statistically less likely to report metabolic, behavioral, or sexual health concerns, which is what one would expect, which is really great news, right? On the flip side, we found that women who had reported any physical IPV throughout their life, whether it was moderate or severe, were statistically significantly more likely to report metabolic, behavioral, and sexual health concerns. What we found with respect to severity is that it has the most substantial impact for sexual health concerns. So when we're reporting sexual health concerns is even greater among women who reported severe physical violence compared to moderate physical violence. And then when we look at age groups, we also found that teens of all age groups of women reported the greatest risks specifically for behavioral and sexual health concerns. Not metabolic health concerns, which makes sense, right? Because that would be, one would assume the effects of chronic stress that result from intimate partner violence, those take some time to build up and start having an impact on metabolic health concerns like blood pressure and blood sugar levels. Next slide. And now I'd like to introduce Dr. Kako, who's going to share with you a bit about her research that she's conducting in rural Kenya.
Hi, everyone. My name is Dr. Penninah Kako. I am an associate professor at the College of Nursing, and my research is focusing on using mobile phone to sustain well-being among women living with HIV in rural Kenya. Next slide. So Kenya has an estimated population of 48.5 million people, and an estimated 1.6 million people are living with HIV in Kenya. Women bear the brunt of the HIV epidemic. And as use of mobile phones in Kenya is approaching 90% of the population, there is really a need to begin to understand how women utilize the cell phone for their well-being. Next slide. So we conducted a study based on focus groups, and the findings from that study showed that the people, including women, use communication from the cell phones to communicate with their healthcare providers, communicate with their children's schools, as well as maintain anonymity. One of the women said, writing messages takes very little time and little money, and it is also very secretive since no one is able to hear what you are telling the other person since the message is written. Also, using the mobile phone tools, women reported that they were able to use the tools to improve information access as well as time management. One woman said, I could send an alarm to remind me of the time to take my medication. In addition, they use their cell phones to conduct business, as well as using the cell phone for cash exchange. One of the women shared that this cell phone has really helped me greatly because I use it as a calculator in my business and to make calls to my clients. In addition to all these positives of using the phone, women did share some challenges that we need to pay attention to. One of the challenges was charging mobile phone, as well as not knowing how to use the phone. In regards to charging the phone, one woman said, another problem is where to charge the cell phone because it is required. Our houses have no power, so we are forced to go where there is power to charge the cell phone. Next person. So in conclusion from this study, we can say that use of mobile phones as a tool can be a tool to expand health literacy programming, as well as self-management skills among those who are living with HIV, especially those in rural areas, in addition to those who are living with chronic diseases in Kenya. Thank you very much. Next, we're going to hear from Dr. Ann Dressel.
Thank you, Dr. Kako. So I'll be speaking about food insecurity among Malawian women receiving end-of-life care. Next slide. Malawi is located in southeastern Africa, and it's one of the poorest countries in the world. It's about 82% rural, and many people there are subsistence farmers, which means that they're growing their own food for their families to eat. Next slide. We had many collaborators on this project, including students in the College of Nursing, and the study was led by our colleague, Professor Makandaweri Valmu. And you can see that we were not aiming to study food insecurity. It was an unexpected major finding. And then we used deductive qualitative analysis to group our findings within the 4 pillars of food security. Next slide. And we found that 100% of our study participants experienced food insecurity. Countrywide, the maize, or that's corn, it's a staple crop in Malawi, the maize yields were down and no women grew enough food to feed their families, and some women were too ill to farm. None of the women regularly ate 3 times per day, and women were too poor to buy food. And some women stayed in abusive relationships to have access to food. Women ate mostly maize or corn, which is not very nutritious, and patients often relied on children to fetch water for cooking, drinking, and bathing. Some women were too ill to cook and others were too ill to eat. And climate change exacerbates food insecurity, and Malawi has been experiencing alternating periods of drought and flooding. Unemployment is also a problem. Women in our study were too ill to farm and too ill to work. We need policies to ensure increased food security for women in our study and their caretakers and families. And we all have an ethical responsibility to address this issue. High-income countries like the United States contribute the most to climate change, which impacts food security, but low-income countries like Malawi experience the worst consequences. So we can advocate with our elected officials to address climate change, and we can lead by example and reduce our own carbon footprint. And we can vote. Who we elect into office makes decisions on climate change policies and funding for the World Food Program and other relevant agencies, which impacts food security in Malawi. So thank you, and I will turn it back over now to Dr. Lauren Galvao.
So thank you so much for the faculty who shared about this very important research. And they are really looking to address major challenges, as you can see. So I hope you got inspired today by their research and that to visit our website, uwm.edu Nursing Global Health, to learn more about these projects and also other projects that are going on in global health. I really hope you are inspired by our talk today. Thank you so much for joining us.